bringing together voices in child and youth healthcare. This is Cathy Presents.
CICC would like to thank the following member organizations for their generous support of our knowledge translation activities: the IWK Health Centre, the Children's Health Foundation of London, the McMaster Children's Hospital Foundation, the Children's Hospital of Eastern Ontario Research Institute, the Children's Hospital Foundation of Manitoba, the Montreal Children's Hospital Foundation, the Holland Bloorview Children's Rehabilitation Hospital Foundation, and the Children's Hospital Foundation of Saskatchewan. We would also like to thank the following Keystone and program partners for their ongoing contributions that support all of CICC's programs and activities. If you have any questions or comments for our panelists, please type them into the question box at any time during the presentation. You can also share your thoughts and questions on Twitter by tagging @CAFCTweets and using the hashtag CAFCPresents. All of our webinars are recorded and can be found on the CICC Knowledge Exchange Network. Use the CAN to share these recordings with your colleagues or register an account and post comments, links, or other resources that you think will be of interest. And be sure to sign up for the CICC Presents weekly email newsletter to stay up to date with upcoming webinars and our recorded webinar archive. Everyone, and welcome to today's episode of CICC Presents. I'm Doug Maynard, the Associate Director at CICC, the Canadian Association of Pediatric Health Centres. Before we get on with the session, I'd just like to mention this time of year, I always like to mention our annual conference. This is the 2016 CICC Annual Conference being held in Halifax, Nova Scotia this year from October 23rd to the 25th. It's only just over a month away, but there's still lots of time to register, so hopefully our CICC Presents audience in person at the conference and get a chance to meet in the real world instead of just virtually as we have over the years. All right, so today's webinar is titled Supporting Young Refugees Through School-Based Solutions, and it's a great pleasure to welcome everyone to today's webinar and to welcome back our colleagues from the CYCC Network to the CICC Presents stage. CYCC is the Children and Youth in Challenging Contexts Network, and many of you have heard their presentations that they've brought to us before or helped us find great presenters to bring to the stage before. And they really do a great job of bringing that content that is certainly relevant to our broad audience and our colleagues from the education and child welfare and social services sector, but they also do a great job of bringing content to our traditional healthcare audience that really helps them understand the broader context of child health and well-being that really impacts children and youth in Canada. So it's my pleasure to first hand the podium over to Rebecca Singbale from the CYCC Network. Over to you, Rebecca, for a few words from the CYCC.
Great, thanks, Doug. Hi, everyone, and thank you for joining us today. My name is, as Doug says, Rebecca Singbale, and I'm the Communications and Project Manager for the Children and Youth in Challenging Contexts Network, or the CYCC Network. We are thrilled to be co-hosting another webinar with CICC, and we'd like to thank Doug and Anne for making this event possible. We'd also like to thank our presenters Cathy Short, Patricia Morrow-Stapleton, and Philip Ackerman for taking the time to share your knowledge and experience with us. So thank you. So to give you a little more information about the CYCC Network, the network is a national knowledge mobilization initiative that supports those who are working to improve the mental health and well-being of vulnerable and at-risk children and youth. We have over 200 network members, including researchers, community-based organizations, educators, policymakers, and beyond. And the network was established with the goal of strengthening the connection between evidence and practice and facilitating cross-sectoral and interdisciplinary knowledge sharing and collaboration between those working to improve the lives of vulnerable young people from across Canada. So we do this in many different ways, but some of our key projects include the development of reports and summary documents and policy checklists on important themes and issues impacting young people. We provide knowledge mobilization and evaluation mentorships to members. We've created a free online toolkit full of tools and resources to support those working with vulnerable youth, and you can find that online. The website is listed there on the slide. And we've also hosted community building and knowledge sharing events called Wisdom to Action in communities across the country. In March of this year, we brought the Wisdom to Action model of knowledge mobilization and community engagement to Toronto to support the settlement and integration of young refugees. So this event brought together 150 people from across the country who work with refugee and newcomer youth. It was a great success. There was fantastic conversations held, and you can find details about this event on our website at cyccnetwork.org. So during the event, participants expressed interest in establishing a community of practice where discussion, resource sharing, and networking can continue. And we're very pleased to announce that today is in fact the official launch of the Young Refugees Community of Practice. And this community of practice is a space to discuss best practices, discover opportunities, and share resources to advance the skills, services, and programs that support refugee young people. There you will find an online discussion board and a resource sharing platform, as well as future webinars and learning opportunities. So if you're interested in joining the community of practice, you can send us an email at cycc@dal.ca, and we will add you to the Basecamp group. And Basecamp is a platform we will be using as our community of practice hub. We'll also be posting discussion questions based on today's webinars, along with the presentation slides on the Basecamp immediately following this webinar. So please, we encourage you to continue the conversation, ask any questions of the presenters there on that resource. And I'll be happy to answer any questions about the community of practice or the CYCC in the discussion period following the presentations. So thank you very much. You can learn more about the network on our website, cyccnetwork.org, and follow us on Twitter at CYCC Network. Thanks very much.
All right, thank you, Rebecca. That will be a great resource for those working with young refugees in Canada, so hopefully everyone does go and check that out. All right, so it's now my pleasure to introduce our panel today. We've got three great speakers coming up to do their presentations now. We're going to be hearing from Dr. Cathy Short, who is a clinical child psychologist with research and practice interests that focus on mental health promotion, knowledge mobilization, and implementation science. She's the director for the School Mental Health Assist, which is a provincial team designed to help Ontario school boards to support student mental health and well-being. She'll be joined by Patricia Mara Stapleton. Patricia is the mental health leader for the TCDSB, I believe that's the Toronto Catholic District School Board. Patricia is responsible for the development and implementation of the school board's student mental health strategy and policy. But first, we'll be hearing from Philip Ackerman, who has worked extensively as an adult educator in Taiwan, Hong Kong, and Canada. And for the past few years, Philip has been committed to working with diverse newcomer populations, focusing most of his efforts in working with youth. And he has been working as the Resource Development and Youth Coordinator at the FCJ Refugee Centre. So it's my pleasure to hand the virtual podium first over to Philip Ackerman. Over to you, Philip.
Thank you very much, and I just want to start by thanking CAPC and CYCC for inviting me to this webinar. I feel very privileged to be here. So yes, my name is Philip, and I work at the FCJ Refugee Centre in Toronto, and I'm going to share a little bit around some of the work that I've worked with refugee and diverse communities of migrant youth here. For those of you that may not know, the FCJ Refugee Centre has existed. It is actually our 25th anniversary this year. Our celebration is tomorrow to celebrate our 25 years. Located in Toronto, kind of the north part of Toronto, running the foundation of the centre is 3 transitional houses for women and children, which opens up into a wide range of community programs and services, working with anybody who comes and seeks assistance. So we do work with resettled refugees from time to time, but the bulk of our work works with inland claimants, so refugees that are going through the process here, or different communities of precarious migrant populations, so possibly refused claimants or people who are living in Canada without official immigration status, including victims and survivors of human trafficking and different communities as that. So for 5 of these 25 years, the FCJ Youth Network has been in existence. The group started with just a handful of youth coming together who needed to kind of create a space for themselves. They felt that there wasn't enough space for newcomer youth in their schools or in other community settings, especially for youth with precarious status. So the group started, and since then it has grown immensely. We have a regular drop-in on Wednesday afternoon, and we welcome 30 to 40 youth every week, often different faces. We're well over, the kind of core group right now is well over 100 youth. And the group really values meaningful youth engagement. So to kind of frame this presentation today, that all of the things that I'm going to be talking about are stemming from the voices of the youth. So I do recognize that I'm speaking to you from as a youth worker and in a position of some sort of privilege and power, but I've collaborated with the youth to put this presentation together, and I really want to make sure that their voices are paramount. So a lot of what the youth have worked around over the past few years, two of the main issues that they've been discussing have been access to education, as a lot of youth face issues in getting into school and then achieving an equitable and fair participation once in school. And then access to mental health has been another one, and then as well as the overlap of these two. Access to mental health support, sorry. And then dealing a lot with the gaps and overlaps between these kind of issues. So a lot of what I'm going to speak about today is from one of the most recent projects that the youth put together, and it's called the Uprooted Education Report. And this was put out at the beginning of this year. The research part of it was done last year. So this was a project funded by the Laidlaw Foundation of Ontario, the Laidlaw Foundation, and they funded the youth to undertake a 2-year participatory research project. So again, a lot of youth, the issue of access to education was really at the forefront for a lot of the young people in the group. And so they identified that they wanted to put together a report to really raise awareness among relevant actors and other youth and change makers and teachers and staff about their unique plight as refugee or non-status or precarious migrant youth. So what they did was they put together a series of questions and the information that they wanted to gather and conducted focus groups in Kingston, Windsor, Leamington, and then a couple in Toronto, and then contacted youth in other areas such as Ottawa, Kitchener, Waterloo, and Hamilton, to name a few. And in total, 67 youth participated. They lent their voices to this project and addressed some of the key issues that they were facing getting into school as newcomers or having a good participation once in school. So I'm going to share some of the results of this report and some of the key findings and some of the things that the youth really thought were important to bring to light, recognizing that there is a lot of variance between school boards. There's a lot of differences from like Toronto as a urban center, that there's a lot more visibility of refugee and migrant youth here compared to like other smaller city centers where the visibility is not the same. So experiences do vary, and so I just want to kind of frame it by saying that some of these things aren't overarching, so it doesn't reflect what's going on in every single school and every single school board and the experiences of every single youth, but there is some relevant themes that I think we can find and we can address here. And another thing that I want to frame this with is that the youth really value, and as well as I do, and I think it's really important to value intersectionality and undertaking these projects and undertaking any responses to these projects with kind of highlighting a real intersectional approach to this. So the picture you see before you was designed by one of the youth, and in all my many years of working in social services, I was looking for a good picture that represented intersectionality, and I've never been able to find one, and then I think this really is almost there. It's one of the nicest visuals I've seen of intersectionality, really showing that the different identities affect and shape our experiences in different ways. So the definition of intersectionality that the youth came up with was intersecting social identities such as age, gender identity, ethnicity, social class, immigration status, sexual identity, experiences with authority, violence, etc., that invite us not to assume the identities of people that we coexist with, but to acknowledge and value each person's uniqueness. And so one of the things that the groups really worked on is to kind of broaden this idea of intersectionality, that it's not just age, skin color, religion, things like that are always brought up, but it's also experiences that many youth have had with interrupted education, being in refugee camps, or experiences with authority and how to interact with authority figures, which could even mean teachers and principals and other school staff. So a lot of things need to be taken into account to have a really broad definition of intersectionality. So the report card, and you can see that the grades aren't amazing here, but the report card for Ontario, what the youth did is that they did these focus groups, they did interviews, and then they did a SurveyMonkey survey that was sent out to lots of service providers, including principals, vice principals, guidance counselors, other school staff, who were able to provide some more context to kind of the issues that newcomer youth were experiencing in school. And from all of this information, they coded it, and they kind of came up with these 5 themes, which are entry, so the experiences of getting into school, and you can see that's the lowest grade there, as a lot of youth are facing kind of many barriers in getting in, and then having an equitable participation once in, so feeling included and feeling that they can participate in the same way as their peers. Anti-discrimination, our policies, anti-discrimination policies working in schools, and how are they working, and are they enough? Support. Do youth have access to support within the schools, and are there links to community supports as well? A lot of youth identify this as really, really important, and at the same time, a lot of youth did find that there were key actors that they were able to find, like a guidance counselor or a teacher or something that really was able to work and understand their unique plight and unique experience. And then moving on, so kind of bridging that gap, that divide after youth graduate high school, and what that means for youth with different statuses, like, for example, refugee claimants at present aren't able to go on to post-secondary without paying international fees. And so that again leaves a lot of youth behind as their peers continue on and receive that support and are moving on to college and university. They are kind of stuck in this situation of limbo, and some of those youth have been in that situation of limbo for 4 or 5, 6 or more years, which is the impacts on mental health and their own visions of self and their own goals and aspirations and everything that is deeply impacted by that. So from all of these findings that I've kind of worked with youth to highlight some of the key factors that shape the experiences of newcomer youth in high school, which I'll share here. And again, I just wanted to say that there are things that are moving to kind of alleviate some of the negative impacts of these things, but I think there is still work that needs to be done. So the first one is the onerous registration processes. So youth have to do assessment tests. They sometimes have to go and get eligibility letters from school board headquarters, showing ID, being asked their status, being asked why they're here by different actors along the way. So there's lots of borders kind of put up along the way to get them in the doors of schools. And the impact of that on many youth is quite detrimental, that it's just the struggle and the hoops and the bureaucracy that they have to go through just to get into that seat in the classroom really impacts their perceptions and how they experience the classroom once they're in it. In addition to that, there's difficulty in obtaining identification. We have a lot of youth who are here with nothing because of their trajectories of migration. They don't have any ID, and so we have to do a lot of advocacy with the school boards. Transcripts, so getting transcripts from a school that has possibly burned down or something, again, it could put them back. It could, instead of being where they feel that they should be, they might feel that they're back. And then other required documentation, sometimes like vaccination records and things like that. Language, cultural barriers, so coming from different education systems and needing to reconcile my previous education experience with what's in my new Canadian classroom can be difficult, and then worrying that people aren't understanding me and I'm not making myself clear. All of those things kind of really come forward. Lack of awareness of and sensitivity to the nuanced immigration situations of newcomer youth. And I'm going to share a couple of quotes from the report card in the next couple slides. So these kind of become a little bit more tangible, but a lot of youth feel that in different moments, and again, not everybody, but in different moments, that they've been treated unfairly because of their status as a newcomer youth. So regardless of immigration status, but they're seen as new, and so they're treated in a different way by staff and peers as well. And discriminatory streaming practices, issues have come to light where a lot of youth, based on factors of their identities, are encouraged to go into trades or are pushed into like taking college level courses instead of university level courses, and not valued for their robust worth. And then added anxiety and stress stemming from immigration. And once again, this will come up in the next couple slides with some of the quotes. But a lot of youth are serving as interpreters for their parents in different aspects, so like even having to skip school to go to a doctor's appointment to interpret for their parents, or needing to go to lawyers' appointments, or other issues are coming up that are taking their time and attention away. And like just one example, we had one youth who talked about how he was sitting in a math test and everyone else was just worried about the math test, and he had a deportation order and was facing deportation the next day, and he couldn't understand how easy it would be to just have to worry about a math test and not have to worry about being removed from the country the next day. If he's still here, the deportation was stopped. So and he passed the math test. So here are some quotes. I've just taken a selection from the from different areas of the report card to kind of highlight some of the intersections with mental health and kind of gain a better understanding of how some of these youth are having experiences within high school. So the first one is, when we come here and get into school and do bad because we're working all night and then going to school all day. I had to work all night. And I'm looking at the other kids and I'm like, I had to work all night. So a lot of the youth speak of this, that they have all these additional responsibilities, and teachers aren't always sensitive to that, and principals aren't always sensitive to that. Many times they are, and many times we've had youth refer to us because of a vice principal who's contacted our center and said, we need to really support this person because they're here by themselves and they have to take on these 2 jobs to make ends meet. They're supporting their brothers and sisters and things like that. The second one, my first 3 years were actually really tough for me. Sorry, I just have to move this. Because I had a really hard time to make friends and I kind of shut myself out. So it was kind of hard for me to want to go to school, and I skipped school a lot because of it. So again, a lot of youth were facing challenges and just kind of negotiating this new environment and trying to make friends, and all of these other impacts or all these other stresses kind of come into play. And then the last one, I was not in class and I watched a video about Africa. The next day, the teacher asked me questions about the video. I'm basically the only black kid in class. I don't know if he's racist or sexist or something. So there's a few examples like this where a student was expected to carry the weight of their country or continent on their shoulders because this young guy was from Africa. He was expected to know all the information that was contained in a video about Africa that he didn't see. Other youth have often been called on to, we're talking about Jamaica, so you need to talk about Jamaica because you are from there. Where many youth have maybe never set foot in that country or have not been there for many, many years. And so that kind of sensitivity lacks at moments. Oops. So from all of these, and the report I think is going to be available on that platform that was just spoken about. From these, in each section, there's 3 or 4 recommendations, which I'm going to highlight here. And so as I speak about these recommendations, I just invite participants to kind of reflect on the feasibility of these recommendations, and then how can we work collaboratively to safely and appropriately implement some of these in our schools if we think that they are necessary. So the first one is a community-driven newcomer youth-informed training needs to be developed and delivered to all school staff across the province. The training should be made mandatory for all staff working in any Ontario school board. So one of the main issues that came up was many youth felt that there was definite staff that were ill-informed or did not have the right information and were referring youth or misguiding them in different ways. Some staff knew things, but there needs to be a better kind of robust overarching training to raise some of these issues. The second one, foster greater dialogue about these issues among relevant parties, including school staff, students, families, community organizations, and policymakers to promote sensitivity to the issue and increase allyship. So a lot of youth, and here's non-status youth, but refugee youth as well, need more trusted allies to connect. So a lot of youth have, when the first time they came to the center, a lot of their initial reaction when they start the youth group is, I wish I knew about you 2 years ago, or I wish I knew about you when I started grade 9. So those links need to be a little bit tighter. And so it comes into this next one, to work with community and community organizations to develop and implement a safe and effective complaint mechanism for youth that feel they have faced oppression, discrimination, or been treated unfairly. So a lot of youth have faced discrimination by peers or by staff, but don't do anything about it because they just think it's going to make things worse. So they don't know how to safely speak about it. They sometimes think, well, the vice principal, I could talk to her, but I think she's going to have the same reaction as the teacher did, for example. The next one, the greater presence of an intersectional analysis in existing programming. most participants agree that programs that specifically targeted newcomer youth is not necessarily a viable solution, as there exists a certain level of stigma for those labeled as new. So there are many school boards have like supporting newcomer youth kind of programs, but many youth were a little bit hesitant to participate in these because that kind of concretes my status as being new, and I'm already facing bullying or facing discrimination based on that. So I'm going to try to put my head down and fit in as much as possible, instead of raising a flag and saying, hey, everybody, I'm new here. So there needs to be work to reduce stigma around that, and there needs to be work to kind of promote a more positive approach to welcoming refugee and newcomer youth in schools. So based on these, we have a lot of work to do around some of the recommendations and more work, but the youth have worked very hard to come up with some different responses, and these responses kind of have two branches. One is awareness raising to bring these issues to light, and the second one is promoting alternatives to education. So the report cards is one example of raising awareness, and we actually have been able to initiate a small amount of change with that. There's different registration processes, for example, for some youth to go to school, and we've also really worked to create a dialogue around that. There has also been a lot of artistic work done. So like one of the youth got some funding to do a zine, which is also available on our website, I believe, which I will show you at the end. And so it's a very artistic approach to, again, raise some of the same issues that were in the report cards around the experiences in education. There's two documentaries available on YouTube. They're called Knowledge, like N-O-L-E-D-G-E. One's focusing on high schools and one's focusing on education in general and post-secondary for non-status youth. And then they started 2 free schools here. So youth that aren't able to access schools, they started a program called Uprooted, which is a free school which brings in professors and PhD students and other academics to run classes at the center. And then based on that, we started noticing more and more younger populations were coming in, like elementary kids that weren't able to get into school for a period of time because of immigration issues. So students from Uprooted U decided and took it on their own to start Uprooted U Junior, which is a program similar, which teaches like English and math skills for non-status or for youth that aren't able to go to school. And then that's just kind of the beginning, and they're continually working on more and more awareness-raising initiatives to kind of create the dialogue and foster a greater dialogue around this. And I think this platform has been one really good solution, and I'm happy to speak more about that. Thank you.
All right, thank you, Philip. Great job. You said at the beginning you're sort of bringing the voice of the youth that you work with, and I think you did a great job. Some great quotes that really did bring their voice as best as we could to this session without having them actually here. So great job. Thank you very much. All right, so we're going to go over to Dr. Cathy Short and Patricia Mara Stapleton. So I think we're going to hear from Dr. Cathy Short. Over to you, Dr. Short.
Great, thanks, Doug. Before I begin, I just want to really thank Philip for such a balanced and important commentary and bringing that youth voice. It is so critical, and the insights that they provide are those that probably no one else could in the same way. What I've learned about this area of work is how nuanced it is, and a bit of a shout out to the Wisdom to Action sessions where I learned first about the Uprooted Education Report and started to advance my own sensitivity to the issues. I think what we're thinking about when we think about doing school mental health in schools is that it is a complex piece of work. Even generally, there are systemic knowledge and implementation challenges, and I think it's perhaps magnified with this particular population of students. So our thinking is that it's important to first address those systemic and knowledge challenges. So I'm going to offer a bit of a view of how we're going about that, and really looking at this as hopefully the beginning of a dialogue with Philip's group and others about where we might go from here. So a couple of background slides. I just thought that it might be important to frame a little bit of our work in what we're doing with School Mental Health Assist. And as you know, I'm going to speak to this in a moment, but I'm going to provide this context and framing, and then Patricia is going to give us a bit of a highlight from a practice perspective in one of our 72 school boards in Ontario. We have a mental health leader position in every school, in every board in the province, and there's lots of great work happening out there in boards, and Patricia has been kind enough to take the time to share one story, and I'm sure that you'll be quite fascinated with the work that's been done. I'd like to also say that we haven't got it all figured out yet. We're all learning together and growing our knowledge together. So again, thank you to CYCC for engaging us today. So a little bit about ASSIST then. We're a provincial implementation support team, and we work with Ontario's 72 school boards in their efforts to promote student mental health. We work alongside the Ministry of Education, and we're part of Ontario's comprehensive strategy related to mental health and addiction. We provide a number of different services. We have implementation coaches that support the complex work of school mental health throughout the province. We also offer some guidance and resources and tools that really are designed to address some of those system and knowledge and implementation challenges. And I will share a little bit about those in a second. But I just wanted to add that in part because of this structure, having a mental health leader as a champion in every school board and having ASSIST as an implementation team, we were able to mobilize fairly quickly in response to the newcomers from Syria in our schools this past year. So if some of you are joining from other provinces or countries, we did have this infrastructure to rest on. I think a lot of what I'll be saying, however, is pretty generalizable, and I think others might be thinking about what's happening in their context and how some of this could be hopefully helpful for you as well. So just a quick view of some of the resources that we're providing. We have 3 main areas that we provide assistance in. They include, for example, leadership and organizational conditions, some ways for board leadership teams to work on those structures and processes and foundational elements that set the stage for effective mental health. And some of these are highlighted here. We also support capacity building amongst educators. So some of the comments from the youth that we just heard about in terms of educator capacity related to mental health. Mental health literacy is a very complex area, and we're doing our best to get some information out to our colleagues about supporting their work that's happening in classrooms across Ontario. And then we help with programming and the selection, uptake, and so on of evidence-based programming in mental health promotion and prevention in such a way that it can be scaled and in such a way that it will be sustained over time. So if you're interested in our work, we have a website you can visit. We work, as I say, quite closely with the Ministry of Education, and the Supporting Minds document might be a helpful resource for you to consider as well. So in terms of our work then with this particular area in newcomer mental health, we were asked by the Ministry of Education to pull together and mobilize some thinking around mental health in schools, and we're tasked with 3 main things. And we pulled together a Newcomer Resource Group that would observe and monitor mental health needs of students as they transition to school. We'd provide a platform so that people could share their materials and resources, and we'd notice where there are gaps and fill those gaps with resources. So we'll be attentive to some of the comments that we heard today about perhaps some next steps in that regard. This resource group is made up of about 30 school mental health professionals, so psychologists, social workers, and also senior administrators. They'd be known as directors or superintendents in our context. And they would be joining us to learn together, essentially, and to do the 3 core mandates that we mentioned in terms of sharing with us what they're hearing on the ground and letting us know where the needs and gaps are, and as well as sharing some great practices that are in play that could be taken up in other places. Knowing that this is an area of work that requires specific expertise, we also assembled a group of experts to provide advice to the resource group and assist, and also to review resources as we develop them. So you can see the list of folks on the screen here. I think I saw Cathy Georgiadis had joined today's webinar. Cathy and others on this list have been tremendously helpful to us as we set our directions in trying to do the best work we can for our young refugees. This is just a quick example, not that you're expected to read it, of course, but that gives us a sense of the kind. We do an implementation rounds, newcomer rounds, each time that we meet. We meet every 2 weeks. And there are a number of activities that a number of activities and a number of issues that surface, and we discuss these and try to come up with some common solutions. So I would say they've centered on things like capacity building, so making sure we support educators with their knowledge about newcomer mental health, making sure that our school mental health professionals who may be serving students who are feeling most vulnerable have the best evidence-based knowledge for their work, that sort of thing. We've created a sharing platform that allows boards, as I said, to upload resources. And we identified some gaps. So the first areas of need appeared to be for educator knowledge, particularly knowing that we were having many families coming to our communities. And some communities are well versed in resettlement, and others this would be a new experience. And so we wanted to make sure we had some knowledge that could be shared out with all teachers across Ontario so they would have this information. So we created an information sheet. It's on our website if it's of interest to you. And it really focused in 4 areas. So creating welcoming school environments, welcoming classroom environments, noticing when there are difficulties, and then supporting students who might be experiencing signs of difficulty. And all within the role of the teacher, recognizing they are not mental health professionals, but they have an important role to play as the eyes, ears, and hearts on the ground to support our students. And then knowing that different people learn different ways, we've also created an educator video that includes guidance related to these same areas, but also gives a little bit more information about if a student chooses them, because you never know if you're going to be the one that a student chooses to talk about what's happened to them and their trauma story. So some words to help educators through that, their own self-care as well as the support they can offer in that moment. And all of our products in Assist are available in both English and French. So the key messages that we've tried to put forward in our work so far is that good settlement leads to good management. We need to take a strengths-based approach, knowing that I would say most of our refugee families who come have experienced a number of hardships and are extremely resilient, and we need to build on that resilience. And then thirdly, that it's our role to know the signs of difficulty and the local pathways to, from, and through care so that we can support students who are in greater need. We encourage our school districts to express any concerns or suggestions through their mental health leader, and to let us know what is needed. So with that, I'm going to turn it over to my colleague, Patricia, who's going to offer a little bit more information just in a context of one school board to give you a glimpse into what our last spring looked like. Patricia?
Great, thanks, Cathy. I just wanted to say thanks to CAPC and CYCC as well for the opportunity and the chance to work with Philip as well. Philip, I liked your example of the Uprooted U or Uprooted University. I think sometimes we have to definitely think outside of the box and outside of the 4 walls to get services or education or support to people who need them when they need them. And I think our example of our journey with our Syrian newcomers hopefully demonstrates a little bit of that out-of-box thinking. So maybe we could go to the next slide. So as our country here in Canada got ready to welcome our Syrian newcomers, it became pretty clear in December, November and December, that we were going to have a whole host of new students joining us. And as Cathy said, the Ministry of Education was trying to mobilize supports and systems for school boards across Ontario to get ready and to use what was already existing and channels that were already existing to help make that support a little easier. So from our perspective at Toronto Catholic, what we did from November to January, trying to kind of scale up and get ready, we took an internal look, map, if you will, of what skills and assets we had, both in terms of mental health supports with specific skill and expertise in trauma-informed care, as well as language supports. We do have a bank of interpreter services, but our needs, currently we have 300 Syrian newcomers enrolled in our schools, but our needs go far beyond what we already had. So we need to really take a look at what we had out there and look at even maybe non-traditional ways of getting some of those language services on the ground where they were needed. So as we were seeing our Syrian friends come across the ocean to Ontario, we knew that there would probably be some lag time before they had a permanent resident and all those kinds of things ironed out. So as we all know, watching the media, many of our newcomers were in temporary housing before they found more sustainable and permanent situations. So here in Toronto, a lot of our Syrian newcomers landed in different areas of the cities, and we worked with Immigrant Services and CICC in particular here in Toronto, which offers immigrant services and mental health support, amongst other services, and settlement organizations to find out where are the pockets. Toronto is a fairly big city. We have 2.5 million people here in Toronto. It's a fairly big city. So we were trying to figure out where the pockets were of families that were finding themselves in different areas of Toronto. And what we did as a school board is we decided to think a little bit out of the box and open up what we called pop-up classrooms. We opened up 2 of them and we aligned them to where those pockets of newcomers were finding themselves. We opened 1 elementary and 1 secondary. And we also tried to make sure that our classrooms were staffed with folks that had English language learning backgrounds, as well as some social emotional supports. And we were hoping, and we provided transportation to and from the housing situations where our newcomers were finding themselves. We were hoping for a couple of things. We knew that some of our newcomers attending our pop-up classrooms wouldn't be settling in Toronto. They'd be settling someplace else in Ontario, and we were okay with that. We wanted for our newcomers to have an experience of some kind of Canadian education, an acclimation, and an experience with what that would look like, what that would feel like. So that was the goal of our pop-up classrooms, as well as giving them a welcoming experience in an educational setting. So we also used, because some of our kids and our families were not of school age, so we also partnered with 2 early learning literacy centers and parenting centers and provided transportation to and from those sites. And we wanted to get the word out. So we had some community information centers. Sometimes that was in a hotel where our families were finding themselves staying temporarily. And we invited community members to join us from settlement, from immigration, mental health, to help us get the word out to moms and dads and guardians as to what kinds of educational opportunities there were in Toronto for their children. So a little bit of different thinking there. Maybe we could go on to the next slide. And I think sometimes when you're offered a whole host of new experiences and new challenges, you absolutely have to get a little bit creative in how you're sort of approaching it. So we started to have families enrolling in our schools sometime throughout last year, starting in January and off to June. Families were finding themselves to find some more permanent situation for housing and were able to enroll in the schools of their choice in communities across our school board. So what we tried to do is, as best we could, link our newcomer families with other families or students or services that have similar newcomer experiences. We were floored by the goodwill of our students, our current students that have had newcomer experiences and wanted to share with the new students and sharing their experience. And I know sometimes, as Philip pointed out, the newness of it can make newcomer students feel a bit singled out. But I think what helped in the situation was young people relating to young people. I could talk till I'm blue in the face about supporting and sharing and being welcoming, but for us, what really tipped the scales was our young people supporting young people. So we also tried to figure out ways to get some information to our schools and to our social work and psychology staff, and we used the information sheets that were prepared by School Mental Health Assist in the work group. And as Cathy mentioned, that helped to alert schools to things to look for, things to be sensitive to, gaining a bit of an understanding and a background of what the situation was like, what might present itself in the classroom, and pathways to help should help be needed. So we were getting that information out to the schools and to our social work and psych staff specifically, because they're often called to action in our school board to consult with teachers, principals, when any social emotional issue were to arise. All the while, we wanted to keep track of what kinds of services we were providing. We wanted to get a handle on, well, what kinds of requests do we have? What kinds of needs are out there? Are there gaps in the services that we have that aren't meeting these needs? So we've been tracking that ongoing. So we have a pretty good picture of things we've delivered and where we've fallen short. And there's absolutely going to be places where we've fallen short, and we need to fill those gaps going forward. We also know that we can't do all this work by ourselves, so we reached out to our lead agency for Toronto, and here in Ontario, the Ministry of Child and Youth Services has divided up the province with different lead agencies, kind of corralling and shepherding and coordinating services for children's mental health. So we immediately reached out to them to try to align our efforts and support. Maybe we could go to the next one. Okay, so September. We always say here at Toronto Catholic, Happy New Year. For us, it is a Happy New Year. It's almost more a New Year for us than it is the traditional New Year. But what we've done now is we've created a mobile newcomer mental health support team. So we have about 300 of our newcomers joining us across our city, and we've developed itinerant social work and psychology staff that have built capacity in trauma-informed care and newcomer mental health. And these folks will be specifically servicing schools that have those identified needs. Now, recognizing that a small team can't help everyone, so we want to make sure that the awareness building is there for all TCDSB mental health staff. So we are currently this month and next month providing professional development for all social work and all psychology staff. We'll be using the School Mental Health Assist video to help us do that, because everybody needs to have an awareness, even if we do have a mobile team out there with more expert level skills. In addition to that, this fall we have our Newcomer Orientation Week program that's launching across our system, and it's part of our settlement workers program in schools that already exists. And these are our student leaders that have volunteered and are working with settlement to provide activities, information sessions, and peer mentoring to newcomers to help make the transition a comfortable one and a smooth one. We'll jump to the next one. Okay, so from now and going forward, I think Cathy was mentioning too about our focus and where we'd like to take things. Good settlement and warm welcome support all students. And I think when we first started looking at the prospect of welcoming a large number of students at one time, it felt a bit daunting. So we tried to look at things that were already in place that could help us. So a go-to for us here in Ontario schools is something called Safe and Accepting Schools, which is familiar to all schools across Ontario and has a lot of those welcoming, support, safe messages and practices that support all students. So we borrowed some of that philosophy to help us build an ecological approach to supporting students. So by that we mean we feel that the whole school environment needs to be primed and ready to offer that supportive, welcoming environment, not just for newcomers, but for all students. Absolutely, there's some specific gain for students that have a trauma background or are newcomers or refugees, but these are good practices that really build a healthy school environment for everybody. And to that, here at Toronto Catholic, we're often talking about looking at things more upstream. How can we create an environment that prevents troubles from happening in a universal way? And we really look at our partnerships with our community as community with school and school with community, vice versa, so that we're working together towards a common goal of safe and welcoming schools for all of our students as best we can, and filling in those gaps that we identified. So that's kind of in a nutshell, you know, our journey from, November till now, and a view of where we'd like to take things. So I really thank you for an opportunity to share our journey with you.
And I'd just like to close by thanking Patricia for taking the time again to share what she's learned as part of her work in her board, and to just reiterate that all school boards across the province will have some of the same common elements that you heard Patricia speak of in terms of resting on existing foundations like safe and accepting schools, that sort of thing, and the key messages that we try to impart. But every school board is also tailoring to their context, and so it may look different in different school boards, but the same intent is behind it. So with that, I'll turn it back to our host.
All right, thank you, Cathy and Patricia. That, again, great presentation. Lots of great work, and lots for the healthcare system to sort of learn from there. The creation of an environment that's welcoming and understands trauma that might influence the goals of whether it's the education system or the healthcare system, and how previous trauma affects that. We've had lots of presentations in the past about trauma-informed care and healthcare and that sort of thing. So I think there's lots of crossover and lots of things for people to learn from this great program. So as I mentioned at the beginning, we will take questions from the audience. If you do have a question, please do type it into the question box. We've got a few minutes to take questions, maybe about 3 or 4 minutes to take some questions. The first question that came in, whether it's for Philip as well, and related to his presentation earlier on, the first question that came in was from Elaine, and she's asking, Cathy, during your presentation, you were talking about the Newcomer Resource Group. She was just asking, how did the Newcomer Resource Group come to be? And maybe you could just give us a sense of what were some of the things that fell into place that allowed that to happen, who was driving it, etc.
Sure. So because we do have these, we actually have an existing community of practice related to school mental health in Ontario. So we meet with mental health leaders and superintendents quite regularly, and our implementation coaches work quite closely with our colleagues in school boards. And so when we were asked by the ministry to try to do some mobilization and coordination work on their behalf related to mental health in particular, we put a call out to all of our mental health leaders and superintendents with responsibility for mental health and asked if there was an interest in becoming involved. And we created some terms of reference that are, I would say, fairly loose for this group, that people can join or not join, depending on their needs, and they will be both learning and sharing. That's sort of how we stage things. And about 30 or so boards put their hands up to say they would like to be part of the conversation. And we decided as a group that we would meet every 2 weeks because, as you've heard from Patricia, we were mindful of the various stages, I guess, or phases of work that might transpire as our newcomers from Syria were coming in particular. And so we agreed on that together. And I would say not every week would we have, some weeks we only had 10 or so join, some we had more. But it was always quite an enriched conversation. I think the other thing to mention is that we were only one piece of the whole ministry and cross-ministry response to newcomers that came together last spring. So we could also rest on the great foundations from colleagues in other branches of the ministry.
Thank you very much. Great response. So once again, if there is anyone who does have any other questions, please do type them in. We do have just a couple more minutes, so if there is one more question that comes in, we'll be happy to take that.
Can I ask a question?
Absolutely, Philip. Go right ahead.
So I think it's a question for all of us. So first of all, I really want to thank Cathy and Patricia for great presentations, and I'm really impressed, and I will share this information with the youth, but I'm really impressed with some of the initiatives that have taken place. And so my question is, there's so many good things happening, and like the info sheets and so much research that's come out of this, and so many resources available, but I guess the issue that came up in the report cards and in the focus groups was the issue is that this information isn't getting to the right people. So these info sheets exist, these presentations exist, these webinars exist, but the people that are at the borders of schools or allowing youth in or engaging youth in different ways aren't accessing these resources. So I was wondering if there's any ideas of how we can work to kind of build better awareness of these resources and kind of help to ensure like appropriate and safe and widespread implementation findings in all of these resources.
That's a great question. Yeah, great question. I mean, that's one of the goals of the CYCC network is to sort of spread information like this. But it's certainly a challenge. I mean, there's so much, like you said, there's so much out there, and we practitioners in all sectors have so little time to sort of seek out that information. So, great question, Patricia. Do you have any thoughts about how we share this, how we get more uptake, more spread is a term I often hear.
That's always on our mind, Philip. We have 97,000 students and 10,000 employees. So we're constantly faced with how do we get this word out. Just speaking from my neck of the woods, I don't have a community perspective, but maybe that's something that we can game out together. So from a board perspective, what we've done is we've created links on our board website, and we've also shared the information with each principal and vice principal. You know, you may be familiar with Ontario schools. The principals are the people at the helm of their ships and getting the information out to their staff. But even still, what we're doing this fall is, because principals have a lot on their docket. They have a lot of things, you know, from fire alarms to you name it. So we're giving the information to our social work and psych staff right now. This month we're in-servicing them, and they're going to be going out to their schools and delivering a very brief 20-30 minute presentation to school staff at the school staff meeting. So we don't want to leave anyone out of the loop. Thought about, oh, let's just take this to schools that have newcomers. You know, not every school is experiencing newcomers, but we thought differently about that. We thought, let's do it a little bit more with, like what Doug said, a greater spread, if you will. That having been said, I think what you're highlighting, Philip, is that you're saying get the information to the right people. Like, for instance, those people that are either trying to help students enroll or admitting students through the admissions and enrollment process. Did I get that right?
Yes, for example, but also I guess sometimes with like guidance counselors have the wrong information, or different actors, but a lot of them are kind of that frontline gatekeeper kind of positions. But yeah, I think that's kind of the focus that I mean.
It's Cathy. I'm back. If I could jump in, if that's all right. Or Patricia, did you want to respond? Sorry.
No, go ahead, please.
I just wanted to add that I think the challenge that you've all identified is a broad one in school mental health, not just particular to our newcomers. But we're trying to take an implementation science approach, which helps us, we think, with coverage, so that we cascade information through the system using the range of stakeholders, and many people have mentioned the many actors, I guess, involved. And we try to do that in an embedded way. However, I think what we're looking for and would really love to tap into the network more about is some communication catalysts. Because I think while it's good to be planful and to roll the information out in a planful way to make sure that we, in essence, reach every student, reach every staff member, sometimes we need to hurry up and get that information out more urgently. And so I think we'd be really keen to talk further about some ideas about how to access the right mobilizers to get this information onto the ground.
Great. Yes.
Yeah, Sarah asked a similar question. She says, thank you very much for taking the time to share the work you're all doing with Newcomer Youth. She says, is there any information, knowledge on what is being done with other school boards across Canada, and is there a way for them to all connect on this initiative? So a similar theme, how do we get this information out? You talked about the other school boards in Ontario, where it's sort of that this information is being shared across Ontario. Are you aware, any of the three of you aware of any initiatives to get this across Canada?
Rebecca,
very brief. Yes. Sorry, go ahead.
Go ahead, Cathy.
I was just going to invite Rebecca to comment if she might want to.
Specifically around school-based interventions like the one Cathy and Patricia presented on, I'm not aware of any in other provinces, and that's just myself. Other staff members at the CYCC might be more aware of those, but I would really encourage anyone also who's listening who's aware of services in other provinces across Canada to kind of share those with us. And that is the role of the CYCC Network, is to find those sorts of programs and initiatives. We are a national network, and to help share those with others. So.
And I do know that the Canadian Council for Refugees is having its fall consultation in Montreal at the end of November, and on one of the workshops is focusing on access to education and specifically moving the conversation outside of Ontario. So there will be people there from Manitoba, as well as Quebec, and as well as other provinces to kind of share promising practices and what's going on in other provinces in supporting refugee and migrant youth communities.
I think more broadly in the area of school mental health, there is a real push for us to be working across provinces because we're all doing things that we can learn from each other regarding. So I think this would be an example of a great need, and although we've had other provinces approach us and we're happy to share anything we have, it would be great to have a platform for sharing.
Yeah, I think this is maybe a good time, if I could, Doug, to just step in. And for those of you who maybe weren't tuned in at the very beginning of the webinar, just a reminder that we are launching today a community of practice online using Basecamp today that is focusing on sharing best practices, resources, connecting, networking, providing webinar opportunities like this for those who are working with young refugees, whether that's researchers, community-based organizations, educators, and the like. So for those of you who do want to continue this discussion, I know we do have some discussion questions that we will be posting on the Basecamp for follow-up from this webinar, but it really is a space that we hope will grow and be quite community-led, and that those who access it can use in the ways that's most valuable to you. So whether that's sharing resources about work that's being done in other provinces or across the country would be fantastic. So for those of you who are interested in joining that community of practice or learning more, you can email us, the CYCC Network, and our email address is cycc@dal, that's DAL.ca. And learn more about us on our website at cyccnetwork.org.
All right. I was just going to ask, Rebecca, if this new community of practice would be the right place for this. So it sounds like it is. And we just put the
great platform, yeah.
Yeah, we put the email address in the chat box so that others can see it. cycc@dal.ca, right?
That's right.
All right. One of the other questions, or actually a comment came in during this about sort of about what's happening in other countries, and Jennifer's saying that school, or not other countries, in other provinces, school PACs and ECE professional meetings would be a good place to share these. She said those are frontline connections, but she says in BC, staff aren't allowed to take on extra things often due to their union, and I think that's a challenge in other provinces as well. Unions do sometimes get in the way when it comes to teachers in particular, but certainly something that I'm sure that can be overcome, of course. But yeah, certainly lots of challenges that makes this difficult at every step. And Jennifer also says, and also to keep newsletters very short with point form, contact info. She says 42% of Canadians are illiterate in reading government documents. That's not refugees who speak English as a second language. A principal's message will reach about 3 people and impact little to none due to the Privacy Act. So again, lots of challenges in trying to communicate, but certainly doesn't mean we don't want to use other tools that are available to us.
Commentary, Doug. I think that the comments are good, and particularly around early childhood. We're hearing a lot about that. That's an area of need and interest as newcomers arrive. And just to say that in my experience, our colleagues from the various teacher federations are quite eager to learn and are actively seeking information to support their members. So I think it's not as much a challenge as perhaps some think. It's an opportunity, I like to say.
Yeah, exactly. All right, we do have a couple other questions, but that I think we've sort of covered for the most part. Unfortunately, we are out of time, so I did want to hand it back to our presenters, and maybe we can go in reverse order. We'll go with Patricia, Cathy, and then Philip. Just any closing comments, any key messages you'd like to leave the audience with before we wrap up. So, Patricia, we can just hand it over to you for any final comment you'd like to make.
Can I make two? Final comment is, I think it's about not so much as fixing things, but creating things. So I feel very strongly that from a school perspective, and maybe even from a healthcare perspective, if we impact the environment, we can create a healthier situation and experience for everybody.
All right, that great comment. And Cathy, any final comment from you?
Yeah, I just think this session has underscored the importance of taking a stance of learning and a stance of humility in this work. And then I'm left really thinking about, more than anything, the youth voices that were brought to the table today.
All right. And Philip, anything from you?
Yeah, just very briefly, I'd just like to, I think, which came out in all the presentations today, is to the idea of resiliency. I think is really important, and Cathy spoke about it a little bit, as well as Patricia. But to go from this kind of positive approach instead of a deficit approach when working with newcomer youth. And again, I can't stress enough how important it is to prioritize the voices of newcomer youth and refugee youth in all of these discussions, and developing these tools and developing these responses. I think nothing can be done meaningfully without them present.
All right, and that's a great way to end this off. So thank you, all three of you, for such a great presentation. I think you covered a lot of ground and really started, I think, a lot of conversations. And hopefully these conversations will continue on at the CYCC's community of practice. So thanks again for such great presentations. And thank you, as always, to the audience for joining us. We do these webinars every Wednesday at 11 a.m. Eastern Time, and it is always great when you can watch live, as your questions and comments really enrich the discussion. But when you can't watch live, we do record these sessions and make them available after the fact, and often along with the PowerPoint presentations if our presenters are able to share those with us. Usually takes a couple of days to get that information up, but you will receive a message from the system with that information when it's available. And you are welcome to share this presentation, and hopefully you will share this presentation as broadly across your networks as you can. Next week, on September 28th, we'll be having a presentation on implementing the NFIT standards, preparing for the impact on clinical practice. And we're going to learn about a new standard that's designed to prevent accidental misconnections between IVs and enteral feeding tubes in hospitals, really driven from a patient safety perspective. We'll be hearing from the Executive Director, Tom Hancock, of the Global Enteral Device Supplier Association, to talk about where that standard came from and some of the issues that were driving that from the patient safety perspective. And then we'll be hearing from Dr. Gina Rempel and Mary Ellen Lee from the Children's Hospital at the Health Sciences Center in Winnipeg to sort of talk about how this is going to impact clinical practice and some of the off-label practices that use enteral feeding tubes, such as drainage and suction, that will be impacted by this NFIT conversion. And then on October 5th, we'll be back with the mental health topic. We'll be having a session called Stepping Up the HYPE, HYPE, Integrating Mental Health and Care Services. HYPE stands for Healthy Young People Everywhere, and that's an international knowledge translation platform that's designed to be a mechanism to integrate national efforts and to link with partners internationally around children's mental health and mental health care services. This webinar will examine the status of youth mental health and health care in Canada and describe the integrated stepped care model currently being promoted in 5 provinces. And our panelists will present the British Columbia Integrated Youth Services Initiative as an exemplar of the model, and related to the youth engagement process. So certainly very much of interest, I hope, to the audience that participated today, and hopefully we'll see you back here in a couple of weeks. And also this week, we're starting, tomorrow in fact, we're starting a new series where we have partnered with the Canadian Premature Babies Foundation, and the series is titled Life with a Preterm Baby, and this is a 6-part series aimed to provide information to parents of preterm infants, although this will also be a great resource for healthcare providers as well, and we'll be focusing on topics such as the importance of movement for preterm infants, breastfeeding and nutrition, common winter illnesses, and lots of other topics that will be of interest to those caring for preterm infants. And we'd like to thank Prolacta Bioscience for their support in making that webinar series possible. So lots of great stuff coming up this week and in the coming weeks. Thanks again for joining us today, and hopefully we'll see you back here next week. Bye.